First is, as more of our population and staff are being vaccinated, and we begin moving towards reopening programs, offices, and facilities, how are we going to handle those clients and staff who have not been vaccinated? Will they continue participating virtually, or will there be guidance in the future?
Well, from a clinical standpoint, for me, it depends on whether or not we've achieved herd immunity around this. And we won't know that until we have enough people vaccinated and there's enough studies done on it. But I don't know how you guys will handle that from a program standpoint. Because as of now, nobody's making it mandatory to be vaccinated.
I think from a programmatic standpoint, we would continue to assess the situation, getting feedback from both internal and CDC sources about best approaches, and would have to say we would take it as we move forward. So we certainly would be as cautious as possible and follow all recommendations from our experts.
Does anyone else want to add to that? Okay, I'll move on to the next question. And this is probably something for Sheena. Are shared services employees able to get the vaccine at FPCN? What about our families if they are in high-risk categories?
Oh, for the first part of the question, yes. Shared services employees are still within those 1A, 1B categories. Are shared services employees that are front-facing, coming into the office every day, or at high risk, are on the same level as all of our employees that we tried to get to the front of the line to get the vaccine. But as we open it up to all staff, of course, shared services employees are in that category as well. And if you have not received information to register, please reach out to me so I can get that to you. As it pertains to employees, high-risk employees, I'm sorry. As it pertains to high-risk employees, they should still utilize, registration links available throughout the cities or locations where they live. For FPCNs, our vaccination clinics, right now it is only open to RHD staff and consumers. When the next phase of that opens up to the public, we will let everyone know. So your family members or whomever will have the opportunity to register. But right now it is just for RHD staff and consumers.
Thanks, Sheena. I don't have any more questions at this time.
Can I just make a few statements about maybe clear up a couple of misconceptions about the vaccine? Do you have time for that? So one of the misconceptions is that there's a waiting period, 90-day waiting period, which has been cleared up if you go onto the CDC website. You only have to wait 90 days to get the vaccine if you have received monoclonal antibodies or convalescent plasma. And this is usually a treatment given to someone who has had COVID and has been hospitalized in the intensive care unit. So this does not apply to most of the population who have received the vaccine. If you had COVID-19 and recovered, or currently have COVID-19 and have symptoms, you would just wait until you're out of your isolation period and asymptomatic, but there is no delay period for receiving the vaccination. There's also been a question of the vaccine causing Bell's palsy. I've heard this one going around on Instagram and Facebook. You're more likely to get Bell's palsy, which is like partial facial paralysis from an everyday virus, including anyone who has history of cold sores. If you just get a regular cold virus, you are increased risk for developing Bell's palsy. There have been reports that handful of people who received the vaccine develop Bell's palsy. And the research suggests that they don't think there's a link between the two. So again, you're more likely to get it every day, just getting any other type of virus, than from getting it from the COVID-19 vaccine. It is a temporary condition, usually lasting a few to several months, and then it resolves. Rarely does it ever become a chronic thing. And usually in that case, there's a family history of Bell's palsy. So those are the two things I just wanted to throw out there.
There's a question in the chat too, that while you're chatting with us, maybe you could answer. Is there information on how best to inform and encourage folks who are resisting the idea of vaccination? I know many who are resisting.
I think the more that people become vaccinated that look like them, who live in their circles and that they see are okay from the vaccine, then they'll be more willing to get the vaccine. Some people, no matter what you do, if you offer them $1,000, they're not going to get the vaccine for whatever reason. So I think, so for me personally, I was very hesitant about getting a vaccine. I don't know if I shared that with you guys before, but with doing the research, I ended up getting a vaccine, and then my family soon followed suit. A lot of my colleagues in the clinic who were hesitant, who are people of color, followed suit. And then more of those people who got it and saw that everybody was okay. And then with the second dose, I got my second dose on Friday. That made more people less hesitant. So I think the more people get it that live around other people who are hesitant and they see that, no, I didn't get Bell's palsy. No, my arm didn't fall off. I didn't grow a third eye. Whatever, people are saying is going to happen with the vaccine, the more people see that those things are not true, the more comfortable and confident they will be about receiving the vaccination.
Great, thank you. I'm just going to ask you one more question. Are there any other rumors that are out there that you can address, since that seems to be the kind of the latest thing happening?
So the only other thing is I've heard people say, well, I had COVID-19. I have natural immunity. I don't need to get the vaccine. Yeah, so getting COVID-19 does offer some natural protection, but we don't know how long that protection lasts. And we know that people can get it again, and that puts you at risk for, severe illness and even death. And as far as the vaccine, as long the studies are continuing to go on, they're starting to see that the vaccines are offering longer protection against the virus than previously thought. They're still not saying how long, but they don't think that we're going to require a booster shot as of yet. There's no evidence that we require a booster shot after the 2 doses.
So there's a little more in the chat. I'm imagining there's not much information about long-term effects yet, but that seems to be a concern. Is there anything you can speak to on that topic?
Yeah. So once you receive a vaccination, typically the vaccine only stays in your system for a few weeks until your body develops the antibodies. And then once that's over, the vaccine is done. You're just left with antibodies that are part of your own natural immunity. So we know that there are some long-term effects from the coronavirus and I think I spoke to this before, with people having chronic pain syndromes that they're developing from having been infected with coronavirus, long-term lung issues, cardiac issues people have as a result. And these are young people who were relatively healthy before coming out, from this disease with long-term sequela. So there's not a lot about long-term effects of the vaccine. Vaccines are relatively safe, but you have to weigh the good with the bad. Like, do you want to take the risk of having long-term sequela from actual disease or from a vaccine, which likelihood of having long-term sequela is almost 0 to none.
Okay, so the questions keep coming. How did you feel from the second dose? Did you have Moderna or Pfizer? And yeah, and the flu, did you have the flu symptoms that people are talking about?
I must have been one of the lucky ones because I had no symptoms other than, like I said before, my arm was sore. Now, the second time around, there was a little bit of a delay on my arm being sore. I didn't actually feel it until like Saturday. It just felt like all of a sudden somebody punched me in the arm. But today I'm fine. I don't have any symptoms. I feel as best as I've ever felt. So I'm really happy that, I didn't let my initial hesitation stop me from getting a vaccine.
All right, one more, sorry. Allergic reactions, conspiracy theories. Can you speak to either of those?
So what kind of allergic reactions? Or can you be more specific? Usually allergic reactions that happen from anything in the environment that's external to your body happens immediately within like the first 15 minutes. So that's why we observe people for 15 minutes to a half hour. Because if anything's going to happen that's like an anaphylactic type reaction, it usually happens almost immediately. I know I've seen some stories about Hank Aaron. He received his COVID vaccine, and then 2 weeks later, he passed away. The man was 86 years old. They're saying that he died of natural causes. He passed away in his sleep. So they're not associating his death at all with the coronavirus vaccine.
Sure.
Okay. Someone asked, is it okay to receive the second dose of the vaccine earlier or later than the window of 28 days? And this person is someone who got their first dose through an organization that is no longer providing second doses. And their second dose is 25 days. So they're asking about that window. I don't know if.
So it depends on, okay, so what vaccine was it? Because that's going to determine
They
where
were
they
not
need
clear.
to go.
They were not clear in their question which vaccine it was.
Okay, so the
Moderna. Sorry, they just told me Moderna. It's
okay, so if it's the Moderna vaccine, we're looking into ways to accommodate those people here at FPCN. You shouldn't get it any earlier. It needs to be 28 days. But the research suggested it can be given as late as 45 days after the vaccine and still be effective. So.
Thank you.
While you're there, hold on, Sarah, why there's another question sort of similar. So in Delaware, we're having an issue getting the second dose. Can we come to Philly to get it at FPCN? Sorry, Sarah, I just figured kind of similar.
Yeah, you're right. Thank you.
I would say if you fall into those categories, yeah, why not? You just have to make sure you bring your vaccine card with you as proof that you received the first dose.
Doesn't matter which they got, Moderna.
So it has to be the Moderna vaccine because we only have Moderna. The vaccines are not interchangeable. So if you had the Pfizer vaccine, you have to find somewhere to get the Pfizer vaccine.
If this applies to you, could you please reach out to me directly? Don't register with the registration. If this applies to you, please reach out to me directly.
Thank you, Sheena.
Thanks, folks. Someone else in the chat asked, said, so once you have the vaccine, you never have to have it again?
So far, that's what they're saying. They don't think there's a booster dose, but more research has to be done because this is a new vaccine. So we have to wait and see where the chips fall. But as of now, they don't think so.
Okay, Sherry, that is all I have on my end.
All right. And that takes us through all the ones in the chat too, correct, Sarah? Or you're going to repeat?
One person specifically asked Nina if she had the Pfizer or the Moderna.
It's the Moderna, the one that we offer here. I got the one that we give. Our trusty MAs gave me the vaccine here at our site. I trust them. You should too.
Residents are asking when they can visit family and increase activity in the community, like going to the library after they have received their vaccinations. You know, if someone that we support has been vaccinated, they're asking questions about sort of when they're able to do some of the activities that they could do before, but, you know, haven't been able to do during the pandemic. So I think they gave the library one as an example, but I think it's more about what are
just in general
protocols changing or not, perhaps.
Yeah, so I think what we do is we rely on guidance from the state, local, and federal government. As you have seen on the news, they've been rolling back some of the restrictions as far as like what percent people can dine out in the restaurant. So, and they base that information on the current numbers. So as those numbers begin to decrease, the government will roll out information on how much more we're allowed to do in the public. So I would say we would just wait for that guidance. I wouldn't, you know, jump at the chance of, going out and being exposed just yet until we start to see some of those numbers decline more. Because I think that's where we saw initially, I'm sorry, where we saw initially is when they started opening up restaurants, and then we had the spike that happened after that, because everybody's chomping at the bit to, get out the house. Everybody has cabin fever. So yeah, I would just wait and see what the guidance is from the government.
And I would offer too, this is Brandon, that our protocols haven't changed just because we get the vaccine. So we're still practicing as if your risk is the same at this point. So just to keep that fresh in everyone's mind until we get clear guidance that it's safe to do so, we are continuing to practice COVID protocols even after folks have been vaccinated. So just to make that doubly clear.
That is per CDC guidance. That's correct.
Yes.
The only thing I might add to that would be that, especially for our folks that are medically fragile and challenged, let's refer some recommendations to their PCP. Because, what the CDC is making general for the general public, and we have folks that have special needs. So in addition to what the CDC is recommending, I'd reach out, especially again, at the risk of repeating for those that we're supporting that have medical fragility, I would reach out to their PCPs and get recommendations, individual recommendations.
Can I just also add to that point, just because you're vaccinated doesn't mean that you're free to just take off your mask and not social distance. We still don't know how the vaccination completely works. As far as you may be protected, but that doesn't mean that you can't still pass COVID on to someone else. So it's important that we still practice those means of keeping the numbers down for now until we know more